Hello, today I'll be demonstrating Juvederm lip enhancement, and we're going to be using a new technique. We're going to use a dermosculpt microcannula. This technique allows us to minimize swelling and bruising. It's very interesting new technology they came up with not long ago, and we're going to be doing this today. Alright, so first we're going to do is, the patient by the way is already prepped. She's been anesthetized with topical anesthetic. Lidocaine 20%, and she'll be cleaned with alcohol prep. So we're going to start with the bottom lip. First we're going to go and create just slow, a little just a bit like this, that's it. Up to this, we're using blunt tip microcannula, which is basically cutting like a needle, but there's no sharp edge in it. The hole in the needle, the bevel is on the side, and tip is blunt, so as it goes in, it minimizes any chance of microscopic trauma to any blood vessels. And we're just going to push it through like this with the skin. The tip is right in the middle right now, and we gradually build this up as we move toward the middle. Like that. Alright, this side is done. You can see there's not much bleeding or bruising. Still hold it for a minute, just compress gently. And again, on the other side, we're using a regular sharp needle to create a microscopic channel first. Just creating a little dent. Let it go, this is fine. Okay, sometimes, there you go. Okay, great. The Juvederm we're using contains lidocaine, which by itself anesthetizes the lips as you're injecting, so the discomfort you may feel at first during the insertion of the needle will diminish in a matter of a few seconds as you do it. Okay, so we move to this side. Go like this. And again, I'm going to go for off the top lip. I'll just take a little bit. And we're going to make a tiny again puncture hole in here. This technique requires obviously some practice. Let this go. Thank you. Go a little bit here, the middle. Once you learn this technique, you never want to go back to sharp needles again, because again, when you use your sharp needles, you may create more bruising and swelling. The sharp edge of a needle, like a scalpel, as it goes to the side of the skin. Alright, just compress this up. So as I said, as the needle, sharp needle goes inside the skin, and inadvertently will cause microscopic cut in blood vessels. Which is not the case with this type of needle. Just go like this and just gently like this. Okay. And in this case, her lips are pretty good to begin with. We're just plumping them up a little bit more. Just to define the shape a little better. Okay, and we always check for symmetry by stretching the lips like this. And I'll give the patient also a mirror. Take a look, tell me if she wants more, or she's happy the way it is. What do you think?
Perfect.
Perfect?
Yep.
Alright. Here you can see before and immediately after lip enhancement using blunt tip microcannula. There is no much swelling or bruising. This shows how blunt tip needle is designed. It has a round tip with bevel on its side. Compare it now to a typical sharp needle. Sharp tip of a regular needle works like a microscalpel. On the left side of this diagram you can see as a sharp needle as it advanced into the skin. It cuts through any blood vessels and capillaries it encounters on its way. And when blood vessel is cut, it leaks blood. Blood deposits into the skin called bruising and swelling. Therefore I think blunt tip microcannula is truly a revolution in thermal fillers in its application. There is much less bleeding, and the result, there is much less bruising.